Basically, myself, Arun Natarajan. Yeah, myself, Arun Natarajan. I have experience about 30 years, almost 28, 29 years experience in the industry. I worked
Mm-hmm.
in across industries like engineering industry, automobile, home appliance, telecom, logistics sector, and healthcare, and in call center collection environment. Okay,
Okay.
so basically my profession is thing is I handled stores, warehouse, logistics, inventory management, operations, purchase, procurement,
Mm-hmm.
vendor payments, administration, HR, everything. I handled over the period of 28, 29 years. I handled all these portfolios.
Okay.
So I started my career with the TVS Motor Company, a manufacturer two-wheelers, right? Suzuki.
Okay.
Those days it's called as a Suzuki motorcycle, TVS Motors. Okay, then I was there almost 5.5 years. After that, I was handling their stores and purchase. So I implemented a lot of Kaizen activities, directly interact with Japanese people and learn a lot of Japanese concept and introduced inventory control systems and implemented a lot of Kaizen activities, TQM activities. Post that, I moved into Tube Investment of India, Murugappa Group. Basically, it's a Murugappa Group.
Mm-hmm.
Division, TI Cycles division. They used to manufacture cycles,
Okay.
bicycles, like Hercules, BSA, SLR, Ladybird, the famous brand. So I was heading entire stores and logistics there. So I worked in another automobile companies and home appliance company.
Mm-hmm.
Then I moved into APC. I worked for APC Schneider. They manufacture server and IT equipments, lot of IT equipments and UPS systems, everything. Then Bangalore. I was heading one of the factory warehouse and logistics there.
Uh-huh.
Then
In
I moved
Bangalore.
into telecom, Bharti Airtel. I moved into Bharti Airtel. So Bharti Airtel, Bangalore. So initially I joined in Bangalore. I was heading warehouse and logistics for entire Karnataka division. So then I moved into Tamil Nadu, Chennai. I was heading entire Tamil Nadu and Kerala for warehouse logistics and procurement. Procurement means right from sourcing to payment, sourcing, onboarding, pricing, contracting, purchasing, vendor payment, everything. So I was heading that thing. During that time, I came to Sri Lanka also. I was there about 6 months in Sri Lanka when Airtel
Mm-hmm.
started in Sri Lanka.
Oh, okay,
So down
okay,
the line,
okay.
1 year's time, I came there and I established complete warehouse and logistics procedures. Almost 3 lakh square feet of warehouse we set up there, open
Uh-huh.
and closed warehouse. I was there about 6 months in Colombo. In Colombo, the Airtel office stayed nearby Hilton Hotel somewhere. I think they stayed there.
Uh-huh.
So post that, I continuously use on getting a lot of transfers and promotion. So moving part of northern part of India and African countries. I had family constraint that time. I had some family issues. Wife was not well, so kid was very small. So at that time I was not able to take my promotions and move outside Chennai. So, but company has given opportunity. I continue to stay in Chennai itself. I forego my promotions. I said I don't want any promotions. I'll stay there. So that company accepted, but given additional portfolios of handling all Airtel businesses. Initially, I was handling only mobile division, then adding DTH, broadband, enterprise division, and Tamil Nadu. Along with Tamil Nadu, Kerala, I handled. So I said I was happily handled because as long as I am there in on my place and handling, I don't have any issue. Then during that time, then sort of friends started saying that why don't we start up some logistics company? So you have almost 25 years of 20 years experience in corporate life, all this. Then I thought, okay, so instead of going somewhere else and taking care of family, so that time I never run behind money. So I thought family is important to take care of it. Then I left Airtel and started our own company that is called Ravan
Uh-huh.
Logistics from March 2014 to 2021, which I mentioned, business united and CEO. So myself and my friends started a supply chain organization. So in March 2014, it's one company I mentioned. Couple of companies we have proprietorship and private limited and mix up. We have started couple of things for accounting purpose. So we used to work with pharma companies for logistics movement. We used
Uh-huh.
to move their all pharma shipments from Mumbai to across country, and other telecom companies and other consumer durables companies and all. We provide complete logistic solution and warehousing. And I do consulting also. I go there and set up their warehouse procedure, administration, all these things I was working. So then that time when any as you know any business it will take minimum 5 years to reach one level and settle. So we are about to take off and grow our business. That time COVID has come. So COVID got stuck up our life because we are the first generation entrepreneurs. We started a thing. So then we are unable to move during COVID because we got because all the factories got shut down. We are not able to do any
Yeah, due
business.
to COVID.
So whatever the funds we had, we already got invested and we taken care of family during the 5 years of time, children's education and all these things. So end up with a huge loss during COVID period. So then we thought I decided, okay, we part for some time in between. Then we carry forward later once the nation comes to then improvement growth period of time. Then we will see by the time we need to take care of our liabilities and close down. Then I moved into again professional life of doing separate consultation or working independently or corporate life. So during COVID, I got an end of the COVID, I got an opportunity to work with one marketing branding company, digital marketing company. It's a known source only, like you. So they due to COVID, they didn't get the business of doing a branding, marketing, promotional physically. Then the idea came to promote the digital marketing. That time they start up a digital marketing organization. So they want a right person to head the entire business and ensure the new facilities developed and recruitment, all these things. So because they put some huge investment. So they approached me. I said, okay, I'll take up the assignment. So I ran that company for 2 years. 2 years, I developed a lot of things, supply chain, complete supply chain. I developed my resource. I developed 1,500 square feet office. We developed. I ensured from resource two to about 40 people. They reached and then supported for business development also. So then that assignment came to close. Then I joined Jesco Healthcare Company. So that's the first healthcare company which I worked for. They normally I was heading entire operations for them for Pan India. So they have stores, billing, logistics, complete marketing support. Marketing used to get orders from across branches and give it into HO. Then we need to supply support for them, support for them. Basically, Jesco, what they do is they do implants, mainly of spine. They specialize in spine implants, and ortho also is there, and general surgical also is there. So initially, as you know, they are aware of a general surgical company, that's Jesco. Then they moved into spine. So across almost I handle around 50 branches across India, 27 branches and 30 channel partners, plus head office in Chennai. So we used to get requirement from across branches. Whatever the doctor said, if they fix tomorrow surgery, then they need they solve whatever the instruments they want. So they give the requirement. So we used to arrange from head office and ensure next day or within 1 or 2 days it reaches to the destination from starting from Chennai to till Guwahati, Assam, across country. So there is
What's the name? What's the name of
branch
the
stock
company?
also available based on the geographical, but Jesco Healthcare Private Limited.
Okay.
Jesco, GESCO, Jesco Healthcare
Yes,
Limited.
yeah, I know it. I know the
They,
company.
yeah. So they manufacture spine basically. So always will run very critically. So I was heading the entire operations for them. That's my first medical healthcare company. But I understood a lot of, they given a lot of training. What's the implant, how to store the implants, how to dispatch the implant. So what is the difference between each and every implants and what is the general surgical instrument? So what is the ortho materials? So all these things they given the training, how to handle, how to clean the material, how to check the quality, check the material. All these things again. So I was able to handle and very well. So from January to till this July, I was there. I was working with them. Then they planned some restructuring, something there. Then so I had to part from them. But still I am in touch with them. That's why I was looking for opportunities. For time being, last 2 months I am working some uh, consultants company. They do banking process, back-end banking process for leading banks like Axis Bank, Federal Bank, MNC company, MNC banks, and Indian banks also, Bank of Baroda. They do complete calling and collection process, collecting money collections. So the loan and card collections they do. So just to engage myself, I'm working last 2 months here. So parallelly, I was looking for by this month, and I am completing my the period here. So, so I don't want to give any break because I have a huge commitments, liabilities, as I said, business loss, all these things. So I need to cover up that losses. So I don't want to take any break. So once my assignment over in JESCO, I just last 2 months I am working here. My assignment here is get complete by this 30th. I will be relieved. So I am looking for some immediate replacement job opportunities. That's why I said even anywhere I am okay to join now. My because my son also grown. So now he is studying third year BTech engineering.
Okay.
Now he will be there with my wife. My daughter is there. She's also grown. So because that time they were kids, I'm not able to move. So
Okay.
my
Okay.
wife also his wife says okay, she can manage her own now. So when your son is there, he can support and take care of now. At least so I can move around and remaining my life. So whatever the
Okay.
period I can be there and clear off my liabilities and I get dedicatedly work wise. I am very confident I can do dedicatedly work. I don't compromise on quality. So very straightforward. So I can believe no money can taken from if any responsibility is given to me, no money can taken from me from the organization. So I'll ensure organizations whatever expectations is there. That is why people used to call even if it's a short assignment, 2 months, 3 months also. I said okay, fine, life has to move on, right? So I have to accept and somewhere I need to keep
Okay.
engaging.
Okay.
Now I am looking at least some long-term assignments so that so every 6 months or 3 months, I can not again and again redo. Now market has also improved a lot, so I'm just looking for a permanent placing.
Okay, okay.
So
So
this is
that
about
means
my
you are able
short brief
to
about me. I'm strong.
you
I'm
can go
strong.
abroad and you can work at the moment, right? So that means even if it is Sri Lanka or some other countries, you can move around and you can work, right?
Yes, even Sri Lanka, I am okay because it's very close to Chennai. It's hardly 1 hour.
Yes.
I already
Yeah.
been there in Sri Lanka for Airtel. I worked there and set up the
Okay.
complete process. I know I worked with you people there. So I established complete warehouse and logistics procedures. So I handle operations there. So fine.
And through this interview, I can get to know that you have a huge amount of experience, right? And also we have from our side, we have a huge amount of networks, right?
Yes.
We are having so many contacts in the
Okay.
healthcare industry. So once we do whatever we can do is we will be
Okay.
sharing the sessions, right, with all the professionals who are looking for a good employee. Right, definitely we will be able to support you in this
Okay.
case. And what do you think? Can you tell us about what are the contributions over the period of your experience? You have gained a lot of experience, right? So through your experience, what are the
Correct.
contributions that you can do for the
Yeah.
healthcare industry? What are the skills that you can say that you can do that in the healthcare industry, such as sales side or marketing or technical side?
Healthcare
So
industry. Sales side, I have less known contacts I can push through. Operation side, I can improve the operations efficiency. Whatever the operations efficiency can be improved from purchasing to till delivery. Whatever the operation efficiency, if you say logistics, supply chain management, they normally use call as a supply chain management. So receiving material, storing, inventory management, and ensure it reaches even if it's hospital, the material reaches on time to deliver for the treating the patients. So the all these things that efficiency can be improved. That's the thing. Operation wise, I can improve the efficiency, cost savings, and manpower utilization, efficient, increasing productivity in the resources that can be done.
okay,
I am well
okay.
versed on that thing, operational efficiency, So that is main thing now. Even when I was in Jesco also, to ensure nth moment the requirement came from the doctor's hospital. Tomorrow morning they have surgery. They need this implant set. Somehow we'll manage and ensure that it reaches the hospital on time. So that's how we manage operation efficiency and increase so that the doctors will not miss the opportunity. See, even that in that case, if they miss our thing, some other supplier is ready to give their implants. Already they are in hospital also. Doctor will use their implant. So we
Yeah.
need to ensure our implant reaches on time. What are the commitment we give to the doctors? We need to ensure it reaches on time, and our team, scrub team, will be there with doctor during the surgery time. Ensure the operation is successful and is supported for the doctors. That thing we ensure that complete efficiency, that operation efficiency and team efficiency can be improved. That I assure. Manpower utilization, man management. That is the main thing actually. Any organization if you take. So handling resources and improving operation efficiency, cost efficiency. Mainly everybody post-COVID, everybody look on cost now. So cost efficiency. So good working culture I can create. So people I can train people and whatever I know, so train people.
Okay. Okay.
So best culture, integrity. All these things are very important. That can be, and that portion I can take care of it.
Okay. Okay. Now I can
Even in
understand
healthcare industry, people
situations,
should
right?
aware what.
Now,
Uh,
now I can understand the
yeah.
situations and what are the contributions that you can make to the healthcare industry. It is clearly understood. And what I'm going to do is I'm just going to share the
Yeah.
sessions, whatever we just had, with all my contacts through our platforms. So we will also try our best to boost up your profile
Okay.
to most of our networks. And no worries, definitely you will be having a good
Okay.
job opportunity from Sri Lanka, right?
Sure. Sure. Yes.
Okay, and
Thank you.
thank you so much. Thank you for your time and
See,
thank you
I'm
for
looking for,
providing your
as I
documentation
said,
and sharing your
yeah.
skills. Right,
Okay.
thank you so much. See you soon.
Thank you.
Okay,
Thanks a
bye.
lot for your support and time
Yeah,
and
okay.
discussion.
No worries, no worries.
Thanks.
Bye.
Thanks.
Bye.
Thanks. Bye.
Yeah, bye.